Hello, Mr. Hanks. I'm Akila from HealthLink. How are you feeling today? Okay. So you're still feeling tired, with fever, and some mild body aches? The reason why I'm calling today is because I want to give you your test results. You have tested positive for COVID-19. Do you know anything about COVID-19? That's good. I see you've done some research. Yes, COVID-19 is a virus that can be spread from person to person within 6 feet through respiratory droplets. These droplets are produced when an infected person coughs, sneezes, or talks. It's also possible for the virus to remain on surfaces, and it can be transferred by touch and enter the body through the mouth, nose, or eyes. Symptoms usually show up in people within 14 days of exposure to the virus. These symptoms include the ones that you are experiencing, but they can also include other symptoms, such as cough, shortness of breath, headache, a loss of taste or smell, sore throat, congestion, nausea, vomiting, or diarrhea. Okay, Mr. Hanks, now I would like to go over some really important safety measures you should take. Feel free to grab a pen and paper and jot this down. To help prevent the spread of COVID-19, you should clean your hands often, either with soap and water for 20 seconds or hand sanitizer that contains at least 60% of alcohol. Because you have tested positive, you should stay home except to get medical care. Do not go to work, school, or public areas. Avoid using public transportation, ride sharing, or taxis. Ask friends or family members to do your shopping or use a grocery delivery service. Always remain at least 6 feet from other people. Cover your mouth and nose with a mask when around others. Cover your cough and sneeze with a tissue and then throw that tissue in the trash. Clean and disinfect frequently. Pay close attention to frequently touched objects and surfaces. The good news is that you've been tested and you can now utilize the safety measures we have discussed in order to avoid spreading the virus to others. Your symptoms are fairly mild, but in some cases, people with the virus can have severe and even life-threatening symptoms. With this in mind, I'm going to go over some of the emergency warning signs for COVID-19. If you experience any of these symptoms, seek emergency medical care immediately. If you have trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, or bluish lips or face. Mr. Hanks, do you have any questions or concerns for me? Okay. Remember, you can always call HealthLink if you think of any questions later. Thank you for getting tested. Have a good day and stay safe.